With Heart Month approaching, what you should know about an underdiagnosed condition. Welcome back to Techstination. I'm Fred Fishkin. With us is Lisa Salberg, founder and CEO of the Hypertrophic Cardiomyopathy Association, or HCMA. Hi, Lisa.
Good morning. Thank you for having me.
A pleasure. So, you've become an advocate for heart health and created HCMA as a result of a personal battle. Tell us the story.
Well, it's a long story. The abridged version is my grandfather passed away in 1953 at the age of 42 from sudden cardiac arrest. That was our first indication something was going on in the family, but HCM hadn't even been named yet, so we really didn't know what the disease state was. Later, my sister was diagnosed with HCM as a child, and my uncle was diagnosed with HCM in the late 60s. And in 1979, 1980, I was identified with a heart murmur in a school physical, went for my first echocardiogram, EKG, chest x-ray, and I was diagnosed with what they called then idiopathic hypertrophic subaortic stenosis, or IHSS. And in the mid 80s, they changed the name to hypertrophic cardiomyopathy. And I lived with HCM for many years. My father was diagnosed after me. My sister, who had been diagnosed back in the early 70s, unfortunately succumbed to a sudden cardiac arrest at the age of 36 back in 1995. And we lost Lori, and it woke us up as a family. I should also mention that back in 1990, my uncle died at 47 from sudden cardiac arrest. So it's been pretty virulent in our family. We go on to other family members carrying the gene. My other sister carries the gene. My brother does not. So we figured out who in the family in my generation was affected. I had my daughter a month after my sister passed away. My daughter carries the gene and has full-blown HCM. My niece and my nephew, my sister's children, both have HCM as well. And now we're looking at the next generation to see where this genetic mutation has proliferated in the family. So I've been at this for quite a while. I've had 6 implantable devices, a pacemaker back in 1992, 4 defibrillators, and in February of 2017, I had a heart transplant. And my transplanted heart wanted some cardiac technology as well. I have intermittent heart block, so I have a leadless pacemaker in my transplanted heart. So I am a heart warrior in every way.
Wow. You've been through so much, but fortunately, you're looking very healthy today. So hopefully
I'm
that's the
feeling
case.
very healthy today. I had the flu last week. I don't recommend that.
Well, tell us about you being able to detect this, and then what can be done. Are there things that what should people know if they do have this?
So if you think about HCM in the news, you probably only heard it related to sudden death in athletes. And yes, HCM is the leading cause of sudden death in young athletes, but that's not the story of the disease. That's a small chapter and an important one, and we don't want that to happen. So we want to not only talk about young people being diagnosed, this is a disease that can be detected from birth to 100. So it is a very complicated disorder that needs appropriate assessment by specialty centers, because we're not just coronary artery disease, we're not just a valve problem, we're impacting the entire heart muscle. So number one, you need to know your family heart health history. If there's anything that your listeners take from this segment, it's stop for a minute and ask yourself, what is my family heart health history? Whether it's HCM or something else, that'll give you an indication on what you and your doctor should be talking about and what you should be screened for. So in HCM, we're going to do an EKG, which can be normal. We're going to do an echocardiogram, a sonogram of the heart, to look at the heart wall measurements and see how thick the heart walls are. And we don't look in one spot, we're looking at over the entire left ventricle. And we're also checking out the left atria, because atrial fibrillation is very common in HCM. About 30% of people with HCM will also encounter AFib, and your anatomy will help determine whether or not you're at high risk for AFib in HCM. So we have to look at the heart muscle, we have to look at all of the chambers, we have to look at the electrical pattern, and that can lead you to a diagnosis. If you have heart wall muscles that are thicker than they should be, then we can evaluate deeper with a cardiac MRI to look at the muscle itself and see if there's any scarring or fibrosis inside of the heart wall muscles. And once we've assessed the anatomy, then we can evaluate treatment options. 5 years ago, we didn't have a lot in the toolbox. We had open heart surgery called myectomy. We had AFib ablations. We had alcohol septal ablation to work on obstruction as well, and beta blockers and calcium channel blockers. But in April of 22, the FDA approved a new drug just for HCM called a myosin inhibitor. You're going to hear a lot more about myosin inhibitors in the future because there's trials in heart failure with preserved ejection fraction and other forms of heart disease. These new myosin inhibitors can help patients avoid open heart surgery because they can address the outflow tract obstruction, so the blood not leaving the ventricle properly. So we're not talking about the coronary arteries getting obstructed like coronary artery disease. You're talking about the actual ventricle not allowing blood to leave. And it happens for milliseconds, which can build this gradient, which can give you pressure in the chest. And you can feel this symptom kind of come and go. And it gets really complicated for patients to understand, why was I okay yesterday, but today I'm short of breath or I have chest pain? And you'll have these intermittent symptoms. You may also have an intermittent heart murmur that's there some days and not there other days, which can be a bit confounding because when you're properly hydrated and rested, you may not have that outflow tract gradient. And when you get tired or you're exercising or walking up hills or stairs, it may become obstructed. So this makes it very difficult to assess anatomy. And this is why we developed our HCMA Recognized Center of Excellence program. We currently have 56 around the United States. And these are where you can get really clear assessments of your cardiac function. We also treat these patients with defibrillators to protect against sudden death, sometimes pacemaker defibrillators if there's other heart block issues going on. And we treat with other medications on top of the myosin inhibitor. We still use beta blockers, calcium channel blockers, antiarrhythmics, and anticoagulants for those who are at risk of stroke.
Very interesting. And I understand that there may be a role that AI can play.
Exactly. So we are currently partnered with a couple of different organizations who are looking at AI-read EKGs and cardiac echocardiography. There's a company called BizAI. They're one of our sponsors. They've got FDA approval to go into large healthcare systems. And when you have an EKG, it goes up to the cloud and it gets evaluated for the features related to HCM that may not be picked up by the regular EKG or by the person who's reading the EKG in the hospital. So AI is a little bit more fine-tuned to look for subtle signals, and we can actually identify those with HCM by using this technology. I'm a little cautious with AI technology, but in this space, I think this is a perfect example of how it can be utilized to help identify the undiagnosed. And we have a big problem with the undiagnosed right now. 1 in 250 people estimated have hypertrophic cardiomyopathy and can be identified. But right now in the United States, we've only identified about 300,000 people with HCM. So there's about another 700,000 that we have to go find. And oftentimes these individuals are defying diagnosis because people don't think about a rare genetic disorder when they're in a cardiologist's office. And the doctor's not always thinking about it either in the GP's office. So if somebody has athletically induced asthma, have been told that they have mitral valve prolapse, have anxiety, depression even can be missed and called depression over HCM. You could also look at your family heart health history, and that innocent murmur isn't so innocent all the time. So having AI technology help us read these EKGs, and now the next step will be helping them to read the echocardiograms. Those techs are still evolving, will help us identify more of the undiagnosed.
And are these people who are undiagnosed, are there other symptoms that they should be looking for, or do they feel fine typically?
So some people with HCM can be completely asymptomatic or think they're asymptomatic. And this is where things get a little tricky. If you have a structural heart disease that developed during your adolescence, you think what you feel is normal. So you may not be complaining or reporting to your doctor the symptoms that you're feeling because you've normalized them. One of the symptoms that probably gets most people is shortness of breath with exercise or exertion that comes and goes. And a lot of people think, well, I'm just getting older and I'm out of shape and I got to lose 10 pounds and then I won't be out of breath anymore. But when this is something that has kind of been creeping up on you, you really need to talk to your doctor about it and then stop and think about your family heart health history. Did your grandfather have atrial fibrillation or stroke? Did your cousin have open heart surgery? Did your sibling have a defibrillator implanted? Is there heart failure? Are there heart transplants in your family? We have a number of families who have had multiple family members go to transplant under different names. Some of them were told they had dilated cardiomyopathy or restrictive cardiomyopathy or just generalized heart failure. So you really want to know what else is going on in the family tree, which can be an awkward conversation for some people to have, but you have to have the tough conversations because yourself and your children and your siblings could be at risk of something as serious as sudden cardiac arrest.
And the test for this, what's entailed there? I mean, a lot of us have had 23andMe
Uh,
and Ancestry and things like that that come back with health reports. They're not indicating anything with this at this point.
So you can, if you did a 23andMe or an Ancestry, you can look at your metadata and you can look for mutations in the identified areas in HCM. So here's the tricky part about genetic testing in HCM. We know that direct-to-consumer genetic testing isn't going to give you the answer. You have to have an ordered panel looking for cardiomyopathies. And there are a lot of different mutations. I happen to be what's called myosin binding protein C3, and that is one of the more common mutations. Myosin heavy chain is another one, and there are troponin mutations as well. So we're able to identify about 40% of people with HCM carrying one of these known genes, which means 60% have an unknown reason for their HCM, which is probably going to turn out to be a polygenetic risk, meaning that there are multiple factors in your genetics that lead to the diagnosis. We haven't quite gotten there yet to be able to use that in practicality, but there's some research projects underway there. So if you have a family history of HCM, you have to test the index patient first. So in my family, I was the index patient, and they found a mutation in me at the time my father was still living. So then we mirrored it to dad's and said, dad has HCM as well. Does he have the same mutation as I do? And the answer was yes. And then we were able to look at the entire family and see who carries the gene and who doesn't carry the gene. And we were able to eliminate some family members. And unfortunately, we were able to add in other family members that thought they were clear because their imaging looked good. So at some point, you go from being gene positive, phenotype negative, meaning your heart's still normal. And then at some point, you transition into having the full-blown disease. Typically, this will happen in adolescence or your early 20s, but it can show up at any point in life. So if you had a test when you were 20 or 30, you're not done testing. You have to continue to screen throughout life.
Very interesting. I understand you have on the website, which will give everybody a discussion group as well.
We have a lot of different services here at the HCMA. We like to meet people where they like to learn, and everybody likes to learn a little bit differently. So we have the website, 4hcm.org. We also have discussion groups for those who have been diagnosed with HCM. We provide a service called Intake and Navigation for every person. I don't care where you live in the world. If you're overseas, we can do it via Zoom. If you're in the North America, we can do it by phone. We can help that person understand all their test results, collect all their information, evaluate their family history, and then we have a nurse navigator help them understand more detailed aspects of their HCM so they can do intake and navigation. They can join a discussion group. We have webinars. I do a podcast as well called Tales from the Heart from the HCMA. So if you want to learn by podcast, which I love podcasts, that's a great way to learn and get engaged. Webinars, websites, discussion groups, or if you've been diagnosed with HCM or suspected in your family, going to one of our HCMA recognized centers of excellence for care is a wonderful place to get your answers.
So steer us to the place we should go to, Lisa.
For hcm.org. We'll give you all the information you need. Our phone number is 973-983-7429. Call us. We'll all be happy to talk to you. We have real human beings here. This was a little passion project of mine, started in 1995, 96, and now we are a staff of 11. And I have West Coast representatives so that my people who are living on the West Coast have my intake coordinator, Sabrina, out there who can help the West Coast people. And Linda, Marty, and Maria are our intake team here in Jersey. We have people in Pennsylvania and in Wisconsin. We're all over the place. And I'm super proud of our team. And it's with this amazing group of individuals we're able to serve the population.
And the site again is the numeral 4,
Numeral 4,
HCM.
HCM.org.
Lisa Salberg, thank you for the work that you and your team are doing, and thanks for spending time with us.
Thanks for having us, and maybe we can talk about something else someday.